Good evening and welcome to Wednesday Night Wellness Live. I'm Dr. Andrew Merrill here in downtown Orlando at Nightlight Chiropractic, and this is our weekly video where we give you all kinds of good news, tips, advice about all things health and wellness. And here we are. I missed you last week. Did you miss me? I hope you missed me because I actually missed you. And this evening I got a wonderful little snippet segment for you. That's really relative, right? So it's the holiday season. I hope you had a wonderful Thanksgiving with your family. I hope you ate a bunch of turkey, a bunch of food, a bunch of all kinds of things that aren't the best things for you, but they sure do taste good. And here we are in between Thanksgiving and Christmas, and it's supposed to be the most joyous time of year, right? So wonderful, so full of joy, of giving, and all good things. But what we typically see here, especially in this office and a lot of other offices across the country, is an increase in anxiety and depression. And it's terrible, right? I mean, when you really stop and think about it, society as a whole might be kind of going off the deep end, which is why we're getting some of this extra anxiety and depression. But I'm not here to talk about that exactly, because I can't fix society. All I can do is help you to stay healthy during this trying holiday season. And that's what we're going to do here this evening. So we're talking about anxiety and depression during the holidays and the quick, easy things that you can do to fix it that you probably didn't already think about. Okay, so obviously we all see and treat anxiety and depression in our own different ways, some good and some bad. But tonight we're going to talk about some often kind of missed ideas about anxiety and depression. So anxiety is the most common psychiatric condition out there. It affects about 1 in 3 Americans throughout a lifetime. There's research on it everywhere about how common it is among Americans. There's also research about how we can treat it, right? So different things that we do currently to treat this. Depression, second most common psychiatric condition, although it's a little bit tougher to track, right? We're thinking major depressive disorders, about 1 in 20 Americans, although again, like I said, that takes a major clinical depression that we're actually seeing and getting the statistics for. So keep in mind, these are really, really common things. If you're suffering with some anxiety or some depression through this holiday season, just understand we've all been there, right? Everyone goes through it at some times in their life. There's some ups and there's some downs. There's some things out of your control. There's some things in your control. There's ways that you can go about kind of managing this, but understand that what you have is not different. It's nothing that we all haven't been through at a certain point in time. It's not a bad thing. Own it, accept it, understand it. We can get you through it. You can get you through it, but you have to first realize it's not something that is bad or taboo anymore. So classic treatment for anxiety and depression is cognitive behavioral therapy, right? You see that a lot. Go see your counselor. Go see somebody that you can talk to, a therapist. I still believe in this. I still use this. My family still likes this idea. If you have never been, maybe you should think about going because it is good classic treatment without many side effects. Second most common treatment now is the pharmacologic intervention, right? And what we see here a lot is these SSRIs, these selective serotonin reuptake inhibitors. And the reason that people wouldn't just, take these en masse, which we kind of have, folks. I mean, these things are out there a lot. Is side effects and dependence, right? Once you start taking these things, first of all, there's all kinds of other weird side effects, and it gets kind of weird. If you look at some of these side effects, it goes down the rabbit hole, but also it's really hard to get off of these things because it does change your brain chemistry in a way that coming off of them would change it in a negative way. So two of the things that we're going to talk about here this evening are about supplements that you can take. They're over the counter, they're very easy to get, and they're used for a lot of other things right now. So you don't think about them for anxiety and depression, but that is a great side effect, I guess, of these things. So the first thing we're going to talk about is fish oil. Fish oil is omnipotent in the health food aisle, right? In the health section of your grocery store or drugstore or wherever you go. And it kind of came in vogue maybe about 15 or 20 years ago because they were finding that it does great to reduce inflammation. It's great for heart disease. What they kind of came to after that is it's also great for brain health. Well, why is it great for brain health? So it's great for brain health because it actually changes how some of the neurotransmitters work in your brain. Part of the same way that in your body, so in your body it works differently by reducing inflammation. In your brain it works differently by changing how these neurotransmitters go. So there's some new research out that it was interesting how it starts, right? So here's how they started doing some of this research. They started by testing rats. So they put rats in a maze, and then they had these anxious rats that are stuck in this maze trying to get out, and then they track how fish oil does to reduce the amount of anxiety, whatever markers they use. And then the second study they use is medical students, because medical students are always under tons of stress. So they take these medical students, and then they put some of them on fish oil, they don't put some of them on fish oil, and then they test these markers of anxiety, and they see that the ones that are taking the fish oil do better than the ones who are not taking the fish oil. So then after that, right, because these are like very small studies, and one's on rats, so it doesn't really count no matter how many they have. We take 1,200 people on either side, 1,200 people who don't take it, 1,200 people who do take it from all walks of life, and we see who does better. And it turns out that the people who take the fish oil do better. Now, there's some other studies that come out about 5 years ago that show that they doesn't, same study, same idea, but it doesn't do as well, right? So there's no change if you take the fish oil. And so here's what we've come to. If you're not taking enough fish oil or the right fish oil, you're not going to get good results. And so therein lies the rub, right? The study that showed that there was good results used 2,000 milligrams per day of fish oil. The study showed that no results only used 1,000 milligrams. So it's weird. There's a therapeutic dose for this, just like anything else out there, that you have to make sure that you're getting, otherwise you're not going to see any results. Now, again, throughout the literature, all the medical doctors, all the chiropractors, all the researchers agree, if you can eat fatty fish, think salmon, think tuna. These are better for you if you are getting these in your diet roughly 2 to 3 times per week. If you can eat fish throughout this season. It's going to help you to get all kinds of good fish oils that is going to help to manage your anxiety and depression throughout the holidays. It's as simple as that. If you don't eat fish, if you can't eat fish, if you don't like fish, can I recommend a fish oil supplement? Now, the one that we carry here, Standard Process Old Prima EPA DHA, is a little bit different because it increased the amount of DHA, which is the stuff that your brain uses, and it decreased the amount of EPA, which is the stuff that is anti-inflammatory for the rest of your body. So it's really designed to be a brain-type fish oil. And if you're searching, right, if you're looking for fish oil, you can't eat fish. You can eat fish, and you just need to eat fish, commenter. If you're looking for fish oil in the grocery store in the aisle, you need to be looking at the label, and it's going to have fish oil and the amount of milligrams, and then it's going to have EPA and DHA listed on the label. And what you're looking for is a higher level of DHA. So if you had to pick one supplement versus another, you're looking for one that has a higher level of DHA, because that is what we're talking about as far as anxiety is concerned. Let's see, where am I here? So the other thing that we wanted to talk about, so fish oil is one of those things that's great for anxiety and depression throughout this holiday season. The other thing is actually vitamin D, right? And I talk about this a little bit in our newsletters. If you're not getting our newsletters, go to drandrewmerrillblog.com, sign up. Totally free newsletter that comes to you every single week. Chock full of information. We talk about things like fish oil and back pain and all kinds of things. But the other thing is vitamin D, right? So vitamin D, we get a lot of during the summertime, and during here in Florida, we get a lot more of it, because what happens is our body, as we're exposed to sunlight, face, hands, arms, legs, our body converts a chemical already inside of us that then turns into vitamin D. And so we utilize that in our body, not just as an antioxidant, but also for a variety of other things that are going on, not just bone health, but a lot of immune type scenarios that are going on. And also your brain is using vitamin D, right? So what they're finding is if you supplement with vitamin D during the winter months, when it's cold outside, when you're not going outside, I mean, it's down in the 40s here in Florida, which means that it's got to be down in the 10s and 20s down there somewhere where you live, or lower. Hi, Dr. Merrill Sr. Anyway, so if you're not getting as much exposure to the sunlight, what you need is to supplement with vitamin D, which is going to help to make sure that your immune system is working a little bit better, so that you don't end up catching colds and flus, which is not because of the cold, it's because you're trapped inside with a bunch of other people with colds and flus. And then it's also going to help with that anxiety and depression that you get going on. Again, probably because you're trapped inside in cold weather with all of the relatives or whatever. Anyways, fish oil, vitamin D to reduce anxiety and depression. You're going to be able to check this video out on Facebook later on this week. It'll also go up on YouTube, and then there will be a blog segment on nightlightchiropractic.com later on this week. As usual, if you have any questions or concerns for me that you'd like answered here on Wednesday Night Wellness Live or anywhere else, you can always email me. It's drmerrill@nightlightchiropractic.com. Otherwise, you can respond to any emails you ever get from us via that newsletter. Let's see, I got a question here. Is there fish oil that doesn't taste like fish that has vitamin D? Actually, I believe that there is a fish oil that is the burpless fish oil. So it's a pill that you take that you don't end up with that fishy burp, which is a bad side effect for a lot of patients who are taking fish oil, that has some vitamin D added. I think some fish oil has some vitamin D added or even naturally occurring in there. I know that sardines have vitamin D in there if you really wanted to eat the sardines, Mrs. Merrill. Anyways, that's all I have here for this evening. I would love to hear from you. You can hit me in the comments section. I will see you later next week for another Wednesday Night Wellness Live. Otherwise, have a wonderful week and get through this holiday season without losing your mind. All right, see you then.